Hello everyone. Last time we had discussed about the ovarian cysts, what they exactly are, and today we will be talking about the diagnosis and treatment of the ovarian cysts and its role in fertility. So usually the ovarian cysts or PCOS or any kind of complex cysts, they are diagnosed, they are picked up by the ultrasound, and best of it is transvaginal ultrasound. Because we can get the exact size and the kind of appearance of the cyst, and we can diagnose the type of cyst. But sometimes if it is missed, or if there is any kind of confusion, we can go for CT and MRI to pick up the kind of complex cyst it is. There's something called laparoscopy. It is a different kind of modality in which we can even do diagnosis as well as therapeutic management of the cyst with a laparoscope. So there's a small cut and a probe is introduced, and which attaches a camera to it, and we can have an exact look of the kind of cyst in the TV, and we can even do the treatment of that cyst right away. Either we can aspirate the cyst, or there's something called cystectomy, in which the cyst is removed right away. Of course, we have to be very careful that we are not touching or cutting any part of the ovarian tissue, otherwise the ovarian reserve decreases. Thus with the laparoscope we can treat the ovarian cysts. And sometimes if we are looking for even less non-invasive technique, then we can ultrasound guided, we can use a needle, and under aseptic precautions we can go inside the cyst and we can just aspirate the cyst out. It can be done abdominally as well as vaginally. And the only thing that we have to be careful about, that these cyst aspiration may refill again in the next cycle or right away. So it might not give a proper treatment to the cyst. And anything else that we want to know about the cyst, and if there is complex cyst and there's any confusion, we can go for couple of blood tests which pick up any kind of ovarian cancer, which are also very common, and thus we can diagnose all kind of ovarian cysts. When it comes to medical management of ovarian cyst, we do not have many options because most of the ovarian cysts do not require any medical management. They get settled by 2-3 cycles on their own when the woman bleeds. But if it's a huge cyst and water-filled cyst and is not coming out or not getting suppressed on its own, then we can use OC pills, high-dose OC pills. We can give it for 2 to 3 months, and usually it helps in cyst suppression, and newer cysts are not formed with the help of OC pills. Thank you.